Hello, my name is Christy Hunley, and today I'm going to be presenting a video and PowerPoint presentation on disaster preparedness for community members living with COPD. I will discuss the reasons COPD patients must be prepared for a disaster, whether natural or man-made, the equipment and supplies COPD patients need to have during a disaster, and emergency resource locations available to community members during and after a disaster. There are two types of disasters, those that are natural and those that are made by humans. Natural disasters include hurricanes, floods, tornadoes, and earthquakes. Man-made disasters occur during a chemical spill, fire, or explosion made by humans. Whether natural or man-made, disasters can result in long periods of power outages, water contaminations, loss of communication resources, and road and transportation closures. Although these disaster occurrences affect all community members, people with COPD are especially vulnerable during these times because many require power-operated respiratory equipment to survive from day to day. During a disaster and evacuation, many COPD members are also exposed to particles within the air that may compromise their respiratory status and cause symptom exacerbation. COPD patients are also increasingly vulnerable due to their reliance on medications and respiratory treatments to manage their clinical conditions. It is important for all community members to be prepared for a disaster by storing an adequate amount of food, water, batteries, means of transportation, list of shelter locations, and emergency communication devices in the event of these resources being unavailable during a tragic occurrence. It is also of equal importance for COPD community members to be prepared for a disaster by having an alternate power supply available, such as a generator for using respiratory equipment. COPD members must also have an emergency oxygen tank available for use until electricity is restored within their community. Having an adequate amount of prescriptions filled before the disaster begins is crucial for members since many pharmacies may be closed for several days during the event. Using a mask purchased from a medical supply store or home improvement store to filter out particles within the air may also be needed for a COPD patient during disaster times. Because a disaster may result in loss of electricity for several days or weeks, and loss of public transportation, no public water supply, closure of stores, physician offices, and pharmacies, COPD community members must practice extra caution to make sure that each member has the life-sustaining equipment and supplies that are needed in the event that these resources become unavailable. Emergency supplies and equipment that are needed by all community members diagnosed with COPD include a generator, batteries, prescriptions, inhalers, and nebulizer equipment, oxygen tank, mask, physician phone numbers, alternate pharmacy phone numbers, hospitals and shelter locations, as well as emergency contacts and a list of medications and emergency records. Here are some examples of these supplies and equipment that all COPD community members must have before and during a disaster. Disaster resource locations must be available to all community members in the event electricity, water, and food is unavailable for several days and/or weeks. In addition to this, COPD community members must have access to locations that provide adequate oxygen therapy and respiratory equipment for COPD management. If a community member with COPD is unable or refuses to utilize the local resources during a disaster, the resulting consequences may include physiologic changes such as an increased shortness of breath, hypoxia, increased levels of fatigue, and later on, perhaps pulmonary hypertension, respiratory infections including pneumonia and influenza, and eventually heart failure and acute respiratory failure. Here are some pictures of locally known resource centers that may be used by East Texas community members with COPD. This concludes the presentation for disaster preparedness of COPD community members. Please complete the evaluation form provided and refer to the disaster preparation handout for future reference.